Lauren Borla with the Roundhouse Foundation in Sisters, Oregon. Meeting the needs of rural communities is often a challenge for a variety of different reasons. People live remotely, they can be incredibly self-reliant and not reach out for help when they need it. Maybe they can't access the services that are available to them, or they aren't even aware of those services. There's an organization we at Roundhouse have supported because it meets so many of the mental and behavioral health needs of communities across so many counties in rural Oregon. Community Counseling Solutions, based in rural Northeast Oregon, serves an area of more than 60,000 square miles. 60,000, with just 100,000 people living across that area. That's remote country, and their work is very much needed. They also run what's called the David Romprey Oregon Warm Line, which started in rural Wheeler County and now serves the whole state. Unlike a hotline for an immediate crisis, warm lines provide an early intervention with a confidential, free phone service. If you or someone you know is wanting to connect, call 800-698-2392. Kimberly Lindsay is the Director of Community Counseling Solutions. I started off by asking her how she got into this work and what kinds of services CCS provides.
You know, when I was in high school, I was told that I was a good listener, but I actually aspired to go into politics a little bit. At the end of the day, though, ultimately, my father died by suicide when I was 10. And I, despite that, lived a great life. Both my mom and dad loved me. Amazing sister. I do think that opened up my eyes a little bit to how trauma impacts people and how do they move forward. And talking with friends and coworkers and fellow students in later years, I just really felt drawn to this profession and supporting people. So we provide services from the Washington to the California border. And then we also have a couple of regional programs. One of those is the Foster Grandparent Senior Companion Program via AmeriCorps. And then we have a statewide program called the David Romprey Oregon Warm Line. And I got to circle back because I forgot also one of our programs specific to Grant County. We operate the public health department and also operate a primary care program there within our public health. So we provide services from cradle to grave. We provide services that you can bill insurance for and services that are 100% preventative and supportive. As a community mental health program, we also provide, within community mental health, as a behavioral health provider, we're providing addictions and mental health services. Closely tied to that, we operate multiple residential facilities. Most of those serve individuals that are 18 years and older, but really excited to mention that we just completed building a subacute psychiatric residential treatment facility in Boardman at the north end of Oregon that will serve what I fondly refer to as the littles, individuals that are 12 and under. And it's the only facility of its kind on the east side of the state providing this service.
Yeah. I mean, that's a lot of things, and you're carrying a lot for a variety of different populations in a variety of different places. So certainly appreciate all of the work that you're doing. But I think the statewide program, let's just double down on that for a little bit.
Alrighty. So in early 2000s, I was at a meeting and I was introduced to a gentleman by the name of David Romprey, who was what's called at the time a mental health survivor. In his early 20s, he experienced his first psychotic break and was in a state institution. And he was in and out of institutions for several years. And when he started to get his feet underneath him and started to reflect back on what was most helpful for him, the medications were helpful, sure, the psychiatrist and the counselors, but he felt that it was the peer support, talking with other individuals that had these big struggles. So he moved to Oregon, and he decided that he really wanted to work in the promotion, work to advocate the promoting peer support. I met him at this meeting, and I just had this aha moment, like, this makes complete sense, and I feel like I just missed the boat, for so many years. So I asked David if we could get together and talk more about what this would be like, and he introduced the concept of a warm line to me, which is very similar to a hotline, only the person doesn't need to be in crisis, which also, like, duh, of course, like, why not be preventative as opposed to reactionary on the backside, which is what the hotline piece is. So we started up the warm line. We just called it the Oregon Warm Line, and received a small grant from the state, $20,000, hired two gentlemen in Wheeler County, Oregon. One was a painter and one was a farmer who had struggled with some mental health issues, to staff this line for 5 hours a week, 5 p.m. to Friday to 10 p.m. And the first week we had one call. That was David just calling to check on him. But at the end of a year, we had about 1,000 calls, which is, amazing. This 1-800 number staffed by these two guys in Wheeler County.
And talk about growth, and obviously there's a need of. It leads into this idea about loneliness and isolation that so many people are feeling. And I know in rural places, especially, that are so far, communities are just far from services, from other needs. When people decide they need support, it's hard to access those services. Talk about how that aligns with, trying to prevent some of these concerns around loneliness and isolation. What are things that you're doing through CCS across the board? I mean, all those things I'm sure are going to stem back to being in community.
I really want to focus for a minute on our seniors. So when you think about who are our most vulnerable, it's, in my opinion, it's the elderly, the disabled, and the young, the very young. And how we treat them is a reflection of upon us as individuals. So what can we do to lift them up in their time of greatest need, especially with the seniors, when for so many years they they were serving individuals. So a long time ago, back in the 70s, the foster grandparent senior companion program emerged. It was born of the AmeriCorps program, which was a very visionary program from one of our past presidents that said, we want to put volunteers to work. We want to put them to work. We want to make this work meaningful. And we want to pay them something. Now, I get that you might say, well, if you're a volunteer, you're not getting paid. But if you're going to do volunteer work most of the time, you got to have some financial support, right? Seniors, sometimes they have to retire for various reasons, but most of them find out, and we see this with our friends and family, that if you retire and you don't have something to do that's meaningful, you're going to start to wither on the vine. So the foster grandparent senior companion program is a way for low-income seniors to stay busy, keep their minds engaged, and be active, and not jeopardize their Social Security, because if you make too much on Social Security, you will lose it. So the foster grandparent senior companion, it pairs seniors who are able-bodied and mentally well with kiddos in the schools who would benefit from somebody reading to them or helping them with basic math. That also pairs these seniors with other shut-in seniors. They earn a stipend of around $5 an hour to go out and provide this work, and because it's a stipend, it does not impact their Social Security. This program has been incredible. It's helpful in our schools. It's helpful to the little kids that are receiving the services. The connection that the kids have with the seniors is incredible. It's like a grandparent, they get very attached and are close. And then for the seniors that are shut in, that are receiving this service, obviously it's vital, especially in our rural areas. So it's a great program. I could go on about it. Unfortunately, the OMB at the federal level has held up the funding, and that funding is going to end, well, really a dead end on July 1st. So we're having to end that program. That is going to, and the last day of operation fully will for us be September 30th of 2025. It's devastating for the kids, it's devastating for the schools, it's devastating for those seniors that have been receiving the services, those that were shut in, and then all of the volunteers, all of the volunteers. And you know what's interesting, Erin, is that that's going to impact their health.
Mm-hmm.
And I really believe that they're going to have more health issues, and it's going to cost more. It's going to end up costing us more. So I've been asking myself, what can we do? We don't have the funds to continue that program, but what can we do to continue to look at ways to provide supports to those individuals who are no longer receiving those supports? And that's probably a different conversation all by itself. I guess I'm just trying to circle back to say that it's incumbent upon us to look at ways to reach out in a very creative way to those individuals. The last 6 words of the Pledge of Allegiance says, with liberty and justice for all. Not for some, but for all. So how do we do that? I'm just going to stop there because I could go on.
And so you've written and spoken as well about the opioid epidemic and what that looks like in rural places, in the communities that you serve. How is it different in rural than it is in urban or metro places?
We know every one of them. Yeah, we know them. They are our neighbors. We see them at church. We see them at the grocery store. Their kids are going to school with our kids, or it's a kid that's going to school with our kid. And it could be a teenager that's not there the next day, or an 8-year-old that cleaned off a counter that had opioids on it and ended up in the hospital, or worse yet. So I think that's the first thing that I think of, is that these are our friends and neighbors, and it makes it, our onion is just much smaller, you know. So in a larger community like Portland, well, I think, you know, at this point, most people have known somebody that has been impacted by the opioid epidemic, but it might be 7 or 8 or 9 layers removed often. But here in Eastern Oregon, it's, 1, 2, or 3 layers removed. So it's just very real. You're having these conversations with your kiddos about why so-and-so isn't at school, or what are all the cop cars, just down the street? Why was so-and-so life lighted? They might be it might be their son or daughter. I mean, I might work with somebody in dispatch in my position, the 911 dispatch center, and their loved one might have been impacted by an overdose. So, yeah, I think that's the first thing. I don't know beyond that, though, Erin, where it falls off in incredibly different ways. And then I've been thinking about that since you said that. I think that some pockets of our population have been even more impacted. And I think sometimes because of the rural nature and our isolation, we also can be easier targets. And most of you don't need me to talk about how the Appalachians were the hardest hit in the beginning with the opioid epidemic, just because they were rural, because information didn't get out there as quick, because they were blue collar workers working in industries where injuries were higher, and these medications were given out like candy, right? So sometimes we can be a little bit more vulnerable to industry influences, and that also impacts us in ways that it might not impact the larger communities.
Mhm. I think when people think about opioids now, and I might be putting words in people's mouth, I don't know. When I think about it, I think about the settlement dollars, and it gets confusing because, especially as a funder, there's this idea that, well, we've solved that now, that there are these settlement dollars. Now it's time to turn our attention to other places. But the reality is that the settlement dollars don't hit communities equitably, and they landed, there's gaps in where they can fund and what they do fund. So how can funders participate in this work to continue to make a difference?
I want to give an example. So the the settlement dollars in Oregon didn't go to all counties. They went to some counties, and each state decided how those dollars were going to get out to their counties. I'm not entirely sure exactly how Oregon did it, but for sure, many of the very small counties didn't receive it. So I think that's important to highlight when you talk about the rural nature that we live in. I'll use Wheeler County as an example. Started the warm line, amazing, received no opioid dollars. But has there been opioid related instances in Wheeler County? Absolutely. Absolutely. I mean, not only do people use it, it's also a pipeline for drugs to come up because it's rural, right? You can get larger shipments through these rural areas. At any rate, if you want to, it just highlights the inequity. Now, I also don't want to sign up to be a decision maker in Oregon to figure out how to get these dollars to everyone. I think that that's a very difficult job. I just would state that once again, some of the small counties were completely left out. Morrow County is a little bit larger. It's where I'm talking to you from right now. They received $30,000 a year for a few years, and then that's going to drop off. I think actually it's already started to drop off. I think they're down around 20,000. Is 20,000 helpful? Absolutely. I don't want to sound ungrateful because I am grateful to have those dollars to talk with our communities about how we can use these funds. And they are not the answer all by themselves. They cannot be the answer. They are not going to address what it needs to be addressed in Morrow County, period. And so going back to the foundation dollars, critical, extremely needed, highly important, so significant, in some cases, bridging the gap, right? Or in some counties that receive nothing, just bringing something into their community that has a focus on addressing the opioid use. Like,
Mm-hmm.
I can't emphasize that enough. In some of those small counties, without the small foundations or donors, they would have nothing.
Mm-hmm. You know, we first connected with your organization because of a opioid related funding project around. Talk a little bit about that work. It's within one of the jails, or folks recently stepping out of the jail system.
Love that program. So we took funds from Roundhouse Foundation and paired it with two other funding sources to begin to provide or deliver MOUD medication for opioid use disorders in the Umatilla County Jail. So, with those funds, individuals are screened if they would like to get started on opioid replacement therapy, Suboxone, or buprenorphine. They can get started at no cost to them. And then when they get released from the jail on that medication, they don't have the craving. And we are seeing a significant reduction in recidivism rates for that population because they're going out doing other things. Hopefully, reconnecting with their family. And they're also following up with us on the outpatient side. It's significant. The medication, especially the tablet, is so inexpensive. It just makes sense. So it was the funding from Roundhouse allowed us to purchase the medication. We took other pieces of funding to hire the staff to provide the needed services, and it's an incredible success. Thank you to Roundhouse for those funds. I mean, it is life-saving.
And it's such a beautiful way to talk about how, I mean, it was a relatively small investment on our end, but is making some big changes and a pilot program that could be replicated in other places. I think it's just a really powerful program. So thank you for running it.
Absolutely. We love it. And I would be happy to talk to anybody who's listening to this program who's thinking about putting something like this in their jails. Like, there are some hiccups or there can be some hurdles, but when you get to the other side, it's amazing and life-changing for those that are receiving the service.
So some of those services were funded by Medicaid dollars in the past. How have federal cuts made it harder? How do you anticipate it getting more difficult?
That's a really good question. Right now, we haven't seen any reduction in the Medicaid dollars, but if you follow the big beautiful bill, by the time 2031, 32 comes around, we're looking at significant reductions. So it's gradually significant over the next 6 years, and will be very impactful. So if no changes are made to that, what our work looks like today will significantly change, and we are going to have to try to get out in front of that and be very proactive in advocating for our services, talking with those who are served, and, I'm going to say it, working with or reaching out to organizations such as Roundhouse to look at ways of partnering. And I think I might have said creative earlier, but just with the dollars that we do have, how can we leverage them best? I think the role of small foundations is going to increase significantly. And I'm not inferring that the dollars are going to increase, but the role that small foundations play in healthcare, especially behavioral healthcare, is going to be significant. And I love it that you all are having these conversations now. I think that the work that you do is going to be incredibly impactful, more impactful than it is today.
So foundations that want to start doing this work, or at least building the groundwork to build relationships, what can they do? How can they do better than they're doing now? Who do they reach out to, whether they're here in Oregon or somewhere else in rural America?
I suppose if you've seen one foundation, you've seen one foundation, right? Like, if you've seen one county in Oregon, you've seen one county in Oregon. I don't have lots of experience working with many foundations. I've worked with some. I would say this to anyone. I'm not just saying that because saying this because I'm talking to you with Roundhouse, but your approach with putting people out in the field, going to the individuals, to the agencies, cold calling. You cold called me. Your employee cold called me and said, "This is who I am, and this is who Roundhouse is, and I'd like to meet with you to see if there's anything that we can do to support you." blew me away, aside from the fact that I think that Rebecca Berry is amazing. So I think who you have do the work is really important, that outgoing, gregarious personality. That's how we got connected. I could go online and kind of get, like, my eyes might roll in the back of my head because I could type in foundations that support opioid work. There's a lot that come up. It's a lot of reading. It's a lot of reading to go through to try to figure out who funds in Oregon and where the matches are. And you don't always know. Sometimes foundations might advertise that they have funds, but they might be more interested in funding existing programs, and you don't know. You just don't know. And I've written a lot of grants that have went unanswered, and so you try to figure out how do you best spend your time. And again, it's just really different when somebody knocks on your door and says, I'd like to see how we can support you. Let's talk. That's the reason why we're talking today. And yeah, I just can't say enough good about Roundhouse's approach to how you're putting those resources out in your community.
Yeah. What are you most hopeful about?
Well, I mentioned earlier the kids program that we're opening up. I'm going to start specific and then I'm going to go up higher. Really excited and hopeful about the important services that will be coming to Eastern Oregon when that program opens. And I'm going to do just a quick shout out, or just mention the building was empty. I mean, we just finished it. It's empty. It's not going to open until late spring. And you may have heard, Aaron, that the community of Boardman suffered a really tragic fire recently, and 4 families lost their homes, and the Boardman food pantry burned to the ground. And as a friend of mine is saying, feeding people isn't political. And so I was able to reach out to the Boardman Food Pantry Board that night that they lost their pantry, and offer them a new home, a temporary home, in our kids' subacute respite facility. We've got a commercial sized kitchen, and the building again wasn't getting used, and that's the new home of the Boardman Food Pantry. I guess that's what I want to talk about, is that's a specific example of people coming together helping people. And that's what that's what's inspiring to me. That's what brings me hope and joy every day. It's when we can get past all of our differences, all of our political divisions, all of the financial or economic stressors, and just say, I can lend a hand, I can volunteer, I can be available. That's where the beauty is. That's what's important. And showing up there, seeing individuals coming with uninterrupted service, and the outpouring of support within the community, and the coming together to do what we do, which is, to feed and nurture and offer support and love. Like, that's what's hopeful to me. And maybe that sounds Pollyannish, but the day that I don't have that kind of joy in the work that I do, to see people getting better, then I don't have hope.
Yeah.
So.
Well, that was my last thing on my list, was a thank you to you for opening that space for the food bank. That was something that we had heard about as well the day that it happened, because we are working on a larger investment to rural food banks and food pantries due to recent cuts and the increased need, and had been in touch with the director of the Boardman Food Pantry the day before about a grant for that work, and then had found out what had happened and found out that they were in your space. I mean, and almost instantaneously. Like, talk about a community that has lifted each other. So that was my thank you to you, of showing up in a way that is not like, well, it's sort of outside our mission, sorry, but just making it work. And then you're right. I mean, food is the great equalizer, right?
Everybody can come together over food, right? Let's break bread. That's in literature that's 2,000 years old.
Yeah.
So that's our roots, and yeah. See, and they're like, we get to be in their space, and for me, I'm thinking, oh no, like, we're getting the greater gift out of this. CCS is getting the greater gift. Yeah.
When we first connected with Kimberly Lindsay and her program in Northeast Oregon, I don't know if any of us had any idea how vast that program was and how many different opportunities and different things and different communities that she was serving through that work. And her desire to really build community around safe spaces and mental health and making sure people feel supported is so powerful. And what a gift to all of us to be able to be connected to her work. When we initially connected around funding the MOUD treatment in the Northeast Oregon jails, it was an interesting conversation at the trustee and board level about that work. But her passion and her interest and her community connections, the fact she's already working with the sheriff's department, the fact she's already working with the community and already known in those places, and that this is a pilot program that can be replicated and implemented in other places, that was a no-brainer and an easy sell for our organization to kickstart and be able to try it. And it's really proven successful. We've talked a lot about different crisis lines on this show, and I'm sure many of you have seen different ads and different things for other crises lines across different advertising platforms. I love this difference between a warm line and a hotline. To be able to connect ahead of a crisis, that early intervention, and the fact that the David Romprey Oregon Warm Line started in rural Wheeler County with 2 guys. They were open a few hours a day, has now shifted to a statewide warm line where people can call and just connect. Just have an opportunity to talk about what's going on. That's such a gift to the state. If you or someone you know wants to use the David Romprey Warm Line here in the state of Oregon, please call 1-800-698-2392. Thanks for listening to Funding Rural.